to see short webinars on COVID. Dr. Alan Dow was talking about asymptomatic people who tested positive for COVID, and there was a study, and I don't remember where this was now, but there was the same exact viral load between asymptomatic people and symptomatic people. So the question was, people that have symptoms, are they more infectious than people that are asymptomatic? And the answer is that asymptomatic people are not less contagious than symptomatic people. So that's kind of scary because you don't really know. Somebody could have no symptoms and they're not being tested, and they could still be spreading the virus. So next slide, please. And the symptoms of COVID-19, 2 to 14 days after exposure, and the average is really about 4 to 5 days. You're going to see most of the time a fever, and it's usually over 100.4 Fahrenheit. Cough, you're going to see about half to a little more than 3/4 of the time, usually a dry cough. But there are more and more cases where sputum production or phlegm is seen. Fatigue seems to be a fairly common symptom. Chest pain, that is usually a danger signal. Chest pain and blueness of the lips, shortness of breath with even any exertion, they're signs that somebody's blood oxygenation level is really going down. Loss of taste and smell, I realized I didn't put a percentage on, and I just looked that up today. And so what is happening, and a lot of diseases actually will block your sense of smell and your sense of taste. So the cranial nerve 1, the olfactory nerve, is actually, there's a lot of inflammation, so that nerve is not able to transmit the sensory to perceive the smells. So they say at least 40% of people lose their sense of taste and smell. It can be up to, some estimates are up to 85% or more, and actually 10% of people that lose their sense of taste and smell don't get it back. So 10% of the time it can be permanent. And there is the people that have had a permanent loss of their sense of smell and taste, there is a correlation with anxiety and depression. Why that is, nobody really knows. But I just read that yesterday and in 2 separate sources, and they talked about the loss of sense of smell and sense of taste. The other things you see are muscle aches. So it wouldn't be like a Charlie horse in one muscle, but it would be an aching all over your body, similar to when people get the flu, just that diffuse muscle achiness. And actually more and more people are talking about having some GI symptoms like diarrhea. And also sometimes people have headache and sore throat. Okay, next slide, please.
Yeah, Karen,
Yes, go ahead.
Someone asked a question about what viral load was. In a previous slide, we were talking about transmission.
Oh, okay. Viral load would be how many virus particles are able to be counted in, let's say, a saliva sample or nasopharyngeal sample, something like that. So viral load would be how many virus particles. Right. And the virus is so tiny, it's like a half a micron. You would need an electron microscope to see it.
Wow.
Yeah. So.
And so oftentimes, sometimes when they talk about that, is that you need a X number of virus particles in order to be exposed for a certain period of time in order to get the infection.
Exactly. And that's what I was saying earlier, think of the concept of time and dose. How close is that person to you? How long are you in their presence? So that's why people were worried if they just passed someone, walking on the street or on a train or whatever, but you really have to be in the person's presence for about 15 minutes. And the magic number is 6 feet, although there was a study that was done a few months ago where a researcher actually, I don't know how this person got research dollars to do this, but when a person sneezed, some people actually, it can go over 20 feet. Not necessarily COVID, but I mean, right. Their secretions can travel more than 20 feet. And So the other concept are super spreader. So some people are considered super spreaders. And so what that means is um, loud talking, shouting, singing. Singing is actually a very dangerous thing. You can really propel your aerosolized particles much further than 6 feet with singing.
Was there another question from one of our participants in the room?
Yeah, Pastor Brett, it's Mike Pfeiffer.
Mike.
Okay, can you expand on the correlation between anxiety and depression? And I thought you said it was loss of taste or loss of appetite.
Loss of smell and loss of taste. I really don't have any more details about that right now, but I can look it up.
So is the thought, just to repeat what you said, is the thought that anxiety and depression increases as a result of that, or it's a correlation to the loss of sense of smell, or how does that? I kind of missed what you were saying.
Okay, sure. The people that lose their sense of smell and taste, there is a higher correlation, I guess, later down the line with anxiety and depression as a result.
Okay.
I don't have more. I'm sorry that I don't have more information about that. I don't think that that's a major side effect, but major symptom rather. But I can look that up and I'll send some information to Pastor Brett.
So it doesn't sound like it's people with depression are the ones who seem to get the loss of smell and
right.
taste. It's more because of the loss of smell and taste, depression connects later.
Got it. Okay.
Can happen later, yeah. Sorry if I didn't make that clear, sorry.
No, I'm sure it was me not paying attention.
Okay.
Thank you.
This was what I wanted to show here was, I wasn't able, Pastor Brett, I wasn't able to get those handouts
Right.
all I could do was put the link in there, but that link is just a CDC handout that has a little picture, drawings of all the different symptoms that I already talked about.
So I could jump out of this and bring those up if you wanted to look at that, or did you just, it can be part of the packet that people can get?
It can be part of the packet, I guess,
Okay.
yeah. I mean, I printed it out, but I wasn't able to, I'm just not an expert with this PowerPoint thing to be able to insert that. I was able to insert it, but it was really tiny and I couldn't make it larger.
Okay.
But the one thing I want to say real quick, I know it's 7:30 already, wow. You want to seek medical care immediately if you have trouble breathing, if you have pressure in your chest or chest pain, if you have confusion, if you have fatigue where you're having difficulty staying awake, or if your lips or face turn blue. I mean, I watched a webinar a couple of months ago from nurses in the intensive care unit, and they were saying that, and I've heard this in other places too, that there's so much lung inflammation with COVID-19 that the slightest exertion, people's, they call it oxygen saturation, or the amount of oxygen that is able to be taken up by the red blood cells, the O2 saturation is so low. I mean, if the person's laying there and they're getting oxygen, their O2 rates may be okay, but as soon as they walk or move, they'll bottom out. I mean, your O2 saturation is supposed to be 95% or greater. And when somebody's sick, they have asthma or something, it might get down into the low 90s, but sometimes some of the COVID patients have gone down to O2 saturations of 60s, 70s. I mean, their blood is just really not getting the oxygen that it needs. One of the things that happens with COVID-19 is at first, you breathe it in and there's a receptor in the lung called the ACE2. Well, there's ACE2 receptors all over the body, but the ACE2 receptor in the actual alveoli, the actual lung sac, is where this virus will attach itself. And you probably have seen pictures of COVID-19, or SARS-CoV-2 rather. It's round and has little tiny spikes all over it, and that's actually how it will cling. It's a clinging mechanism. So it attaches in the lungs, and what happens later on is the body recognizes this virus as foreign, and not everybody has this happen, but in people that are hospitalized, they have what's called a cytokine storm, where the immune system just goes into like a hyper reflexive state. It just overreacts. And so that is, when people need to be on ventilators, they need to have oxygen. And that's where some of these drugs have come in. I'm going to talk a little bit about the drugs in a few minutes. I don't want to go into a lot of detail, but that's the cytokine storm is when many people actually die. It's their own body just over attacking this virus. Okay, next slide, please. So the testing for COVID-19. So the type of test that's being done now is a nasopharyngeal swab. And they really do have to put the swab, it's a Q-tip, a long Q-tip that goes in the nose and all the way back to the very back of the nose where it meets the pharynx or the upper part of the throat. And they're actually looking for RNA particles from the virus. So it's called PCR testing. So PCR stands for polymerase chain reaction. And this type of test can actually diagnose an infection, okay? There is a saliva test. I have to say, woohoo, it was developed at Rutgers University. So we are gonna be, when we will start testing, in the later summer and fall, we will be using the saliva test. So it's kind of like an ancestry DNA test or 23andMe. You just kind of spit into a little container and put the lid on, and there you go. It's easy as anything. One of the things they were saying yesterday on one of the webinars I watched is that the point of care, not all tests are created equal, and some of the very quickly manufactured, inexpensive tests may not be as sensitive and specific as needed, because there can be false positives, there can be false negatives. So the type of test that the county is using, and Quest and LabCorp, they're all fine tests. I feel confident if somebody went for a test that it would be a sensitive, specific test. Okay, antibody testing is not ready for prime time yet. That does not diagnose an infection, but it could tell you if you've had the infection in the past. So it takes about 1 to 3 weeks for antibodies to form. And an antibody is your own body's recognition of something foreign, and you create an antibody against an antigen. The antigen would be the virus. So your body creates an antibody. Now the problem with this is we don't know whether in many illnesses, if someone creates an antibody, they are no longer infectious, and in many diseases, they can't get it again. But we have no idea what is going to happen with COVID, whether the presence of an antibody confers immunity, or if they do have an antibody, how long that antibody lasts. So these are all the unknowns. Nobody really knows yet.
Yeah, Karen, it's Nancy.
Hi.
I just read something the other day that they're saying that the antibodies aren't like staying with the body.
Right, yeah. They're not, it's not something that persists throughout the person's life, right? Yeah.
Okay.
They can become susceptible again later on in life. So one of the things you want to know is viral shedding can last for greater than 20 days in an infected person. I mean, the person is technically no longer infectious, but they still have virus in their body that they're getting rid of. So if you test that person over and over and over again, they may still have a positive test, but it's not because they have a new infection. It's just because the person's body hasn't cleared that virus out yet. So the danger is doing too many tests, that you'll still get a persistent positive, even though they're no longer infectious. Okay, next slide, please. Vaccines, I did an exhaustive review of the different types of vaccines. There are dozens of vaccines out there, but there are two major players really. Of the vaccines, there is, any vaccine actually gets the body's immune system to recognize a specific pathogen and fight it off so you don't get sick. There's no vaccine available yet for COVID-19, And what they're going to be doing with any of the vaccines that hopefully will be developed is they'll take a small bit of the spike protein, that little spiky, the little things that jut out on the surface of the coronavirus. They won't take the entire virus particle, because then that obviously the person could get sick with that particular illness if it was the entire virus particle. But it's just a small bit of the spike protein, enough that the body would recognize it as foreign and create an antibody against it. And usually vaccines usually take years, like they say 10 to 15 years is not unusual for a vaccine to be developed. And I know that time is really going quickly here, but there are different phases: phase 1, phase 2, phase 3. The testing. Oh, actually, could you go to the next slide, please, Pastor Brett? So Operation Warp Speed is actually a task force to fast track the development of the vaccine. And the goal is 300 million doses by January of 2021. So I don't know. But without a vaccine, the virus would keep spreading until 60 or 70% of the population would be infected. Okay, so which would be a huge death toll. That would be thousands and thousands of people. What did I write to you today, Pastor Brett? The speaker said something about, let me find out.
Let me see, I'll look it up here.
I have it. This disease is just following the concentration of humans. I mean, that's really all that any disease does, but that's what's happening. It's just following the concentration of humans. So until 60 or 70% of the world's population has had this disease, it's going to keep spreading around.
So to put those numbers, being a math guy, put those numbers into perspective, right? 70% of the U.S. population.
70% of 330 million.
Right,
Yeah.
times 4.5% of those people that are infected. That's the fatality rate.
Exactly.
Right, that comes out to almost 9.5 million people.
And then if a virus or a disease affects 60 to 70% of a population, that is what we call herd immunity. So even if not everyone in that population gets a vaccine, if 60 or 70% of a population has been vaccinated, the other 30 or 40% don't necessarily, should be vaccinated, really, in my mind, but may not be. But they may not get the infection because the other people have all been vaccinated. So the estimations by the CDC are probably about 30% of Americans will not want to get a vaccine or won't get a vaccine for whatever reason. And Dr. Fauci said yesterday, that if the vaccine was 70 to 75% effective, that would be acceptable. I mean, of course you want it more than that, but and the flu vaccine, sometimes they say, oh, it's 60% effective, or, every year it varies. Okay, next slide, please. So the front runners of the vaccine candidate, Moderna and actually Pfizer, are doing messenger RNA from the spike. So it's a very small gene sequence from the spike protein, and they're coating it in a tiny ball of fat, and then injecting that into the body as the vaccine. The fat will melt in the body, and the mRNA will trigger the immune system to create antibodies against the spike protein. So actually that one, the Moderna, is entering, they just said today that in early August, it's going to go into phase 3 trials. And phase 3 trials are going to be the time when, lots of people are given this vaccine. And let me see if I can find that. Sorry, I'm shuffling. I have all my references right here for to go to quickly. That's going to be the time when they'll have thousands of people that will be getting the vaccine, and they'll be able to tell if the vaccine is effective or not in the phase 3 trial. Thousands of subjects, and you can tell whether it works or not. And really, what the speaker today was saying is that if there's a lot of disease happening in the country or at the time of the phase 3 trials, it will take less time for that phase 3 trial to be completed, because they'll be able to have a placebo group and a vaccine group. If there isn't much disease activity at the time that they're doing the phase 3 trials, it's going to take a lot longer, because they're not going to be able to enroll as many subjects. So that was something, interesting to hear just today. Next slide, please. Oh, Pastor Brett, I should really wrap it up in a couple minutes then.
What are we at here?
Well, it's 7:45.
Yeah, well, keep going.
I'm almost done.
Okay.
The other vaccine that is kind of interesting, so there's really two types of, two different types. So the one I just told you about is an mRNA. It's a small bit of the gene sequence from the spike protein. This one, a small bit of DNA from the virus is going to be added to a harmless common cold virus. They call it adenovirus. And the adenovirus will be manipulated so that it really can't reproduce in the body, so you can't get sick with a cold, is what I'm trying to say. But they'll treat the adenovirus with enzymes to destroy the remaining adenovirus, and then they inject that, whatever's left, into the body. So it's, kind of bound to a harmless common cold. And a lot of other vaccines actually have already used this. There's been an Ebola vaccine, there's RSV, respiratory syncytial virus, and other vaccines have been used, have been created rather, with this common cold virus. It's actually a chimp adenovirus. I don't know if you want to know that much detail, but anyway. And phase 3 trials are already starting in England, United Kingdom. And they're going to start trials in Brazil and South Africa. So.
You want to touch the end of the Zoom?
Yeah.
Want to touch the end of the Zoom?
Sorry about that.
I'm not understanding what that
Don't worry
is.
about it. I just,
Okay.
Go ahead.
Okay, and then next slide, please.
Yep.
How to protect yourself. No, I'm sure everybody really knows a lot of this. It's kind of a review, but avoid contact with anyone ill. And then socially distancing, 6 feet apart at least, and actually even further if it's going to be shouting and singing and things like that, somebody coughing, those particles are going to propel even further than 6 feet. The masks, a cloth mask is good. You can wash it. 2 to 3 ply is what they're saying. A single layer bandana is really not that effective. You want to store your mask in paper, a paper bag, not a plastic bag. And the reason why is if plastic, it'll stay moist, it could grow mold, things like that. Wash your hands for 20 seconds frequently. And then I did say, don't touch your face, mouth, or eyes. So as a nurse, I've kind of trained myself never to touch my face. And of course, as soon as I put a mask on, something on my face will itch like crazy. But, I've kind of trained myself not to do that. Just today, I listened to a webinar and they were talking about hand sanitizer. So this is something you might hear about more. Hand sanitizers from Mexico actually were made not with ethanol alcohol, but with methanol. So there were some people in New Mexico actually that were, had alcohol issues and were drinking hand sanitizer. And there were deaths actually from methanol poisoning. And the other thought is methanol could be absorbed through the skin. So the take-home message is look at your hand sanitizer and make sure that it says ethanol alcohol. Not if it just says alcohol and it's from, not from the United States, let's say, it could contain methanol, which could be, harmful. I guess you would have to slather your whole body in methanol, but these people were actually drinking it, you know, as a way, and it was sad. The speaker was actually talking about Native American reservation where it's dry. They, you know, people have no access to any alcohol, and they were, you know, consuming the hand sanitizer. So that's very sad. But yeah, you know, make sure your hand sanitizer says ethanol alcohol. And I checked mine and it does, so. All right, next slide, please. How to protect yourself, continued. Self-isolation, so you want to separate an ill person from others. And that would be 10 to 14 days. If you have COVID, you really want to isolate yourself for 10 to 14 days. From the time you were diagnosed or when symptoms start. Quarantine, that's keeping someone who may have been exposed away from others. So the person that's quarantining doesn't necessarily have COVID, but they're just staying away from others if they've been exposed to somebody. And you want to stay, you know, like I said, 6 feet apart or more from others, spend less than 15 minutes in close contact. Yesterday, the VCU webinar, there was a question, what about protesting? And to this date, the Black Lives Matter protests and all the different protests, there have been no increased rates of COVID-19 from people protesting. Although that may change because now they're finding the aerosolized particles may even be spread outside. You know, my whole family went to a Black Lives Matter protest June 9th, wasn't it? June 9th. And most of the people had masks on. And I have to admit, I stayed on the outskirts of the crowd. So I would say if you go to a protest, wear a mask, stay on the outskirts of the crowd, you know, just be mindful of not being too close to others and things like that.
Karen,
Yes?
this is a little bit not exactly what you were talking about, but as a person who works at Rutgers, how do you feel about all this going back to school? And do you feel comfortable with these kids coming back on campus in the fall?
Well, they're actually really not going to come back.
Oh, okay.
We just got an email yesterday, 2 days ago, and most of the classes are going to be online classes. Some of the classes that require labs, like nursing students and biology, chemistry, you know, there will be some labs, but almost everybody will be doing online classes. Mm-hmm. And very limited housing. Mm-hmm. Very limited housing, which is, you know, it's okay. We're still seeing patients, students, because I do telehealth. Mm-hmm. So, you know, we are still taking care of the students' medical needs, and the psychologists and the psychiatrists are doing that too.
Because our grandchildren are involved in 3 separate colleges, and they're all saying that they're going to go back in the fall. And I keep thinking, how do they think they're going to do that? I just think that's not going to happen. But
yeah, well, Dr. Holloway, our new president, had sent a couple days ago, we got a whole long document, and people have been working months on this. Mm-hmm. You know, the dorms would have to be, instead of 4 kids, it would be, you know, two students. You know, there would have to be a whole cleaning procedure. There would have to, you know, laundry rooms would have to be set up. I mean, everything would have to, Rutgers really has thought of it. I have the packet right here. It's very, I would say it's about 87 pages long, Lauren said. Yeah. So, you know, they really have thought of everything. But in the interim, from the time I got this last week until 2 days ago, they've decided that they're not going to have.
That's interesting, and I feel that that's a very sensible, good decision.
Yeah.
Disappointing for the kids, but a good decision.
Yeah. Okay,
with the phased reopening in the state of New Jersey, is the data granular enough that they're able to identify kind of cause and effect? So in other words, you know, okay, people could go get their haircuts, and as a result of that, we see a spike here or there. Are they able to pinpoint that so that if the numbers start to rise, they know where to pull back?
Yeah, I mean, really, a lot of things just opened June 22nd, so it might be too soon. But right. I think that one of the reasons why Governor Murphy, is pulling back on indoor dining. And just today, I didn't even get a chance to really hear what he had to say. But my coworkers texted me, apparently now masks all the time, even outdoors, if you can't social distance. I think if you can social distance and you're outdoors, you don't have to wear a mask. But I think that, all the other areas across the country are influencing Governor Murphy's decision to kind of, dial it back, to not open so quickly.
Plus, he said yesterday that there's been an uptick in.
Yeah.
So he's just being cautious. And
right. And I'm not oh, go ahead. I'm sorry.
Everybody that gets all upset about what he's doing, go ahead.
Well,
get the virus. Go.
I mean, I'm not a public health expert, but I feel like I've taken a crash course in public health in the last 4 months.
Mm-hmm.
And he has very good experts, very, very knowledgeable experts advising him. I mean, maybe people aren't happy with some of the things that he's recommended, but it's really from a public health standpoint, he's running a tight ship. Let me just say that.
Yeah, I think I shared with Pastor Brett that I read a week or two ago that the model that's being used in the state of New Jersey is actually being recognized around the world as being effective and a model to follow. So I think collectively we should all be fortunate to be here now.
Mm-hmm.
Yes, and just yesterday, I believe Delaware is considered a state that if you're in New Jersey and you travel to Delaware, you're supposed to quarantine.
Right.
So there's 19 states.
Yeah, it's like, I think it's even higher than that now, Karen.
Oh, okay, yeah.
Or low in the 20s.
Okay, wow. I did want to talk for just a minute about the medications that are used when people are sick with COVID. The hydroxychloroquine there was a lot of press about that early on. It really isn't used now at all. It's an anti-malaria drug, and it's also an anti-inflammatory drug for people that have diseases like lupus and other autoimmune diseases. And actually, they found that the mortality rate was higher when people were given, I call it HCQ. So that's really not being used now. There is a drug called remdesivir and some other antivirals that have similar long multisyllabic names that are antivirals, and they will shorten the disease progression process from 15 days down to 11 days. So it's not a magic bullet. The person still has COVID-19, but it's a shortening of the disease process. The most recent drug that was really investigated, and it was a study from England, is a drug that's been around forever. I mean, since I've been a nurse, people have been given dexamethasone for various things. I mean, it's a kind of an oldie but goodie. It's used in a lot of different settings. We used to give it to pregnant women if they were threatening to have premature labor, to help the fetus's lungs mature faster before the woman actually gave birth. But the dexamethasone is given actually to the sickest patients, people that are on vents, people that are receiving oxygen, and what it does is it really decreases the cytokine storm. So that overreactive phase of the COVID-19 where the person's immune system is it's like thick, sticky, tenacious mucus, and the person can't even get oxygen into their lung cells because the mucus is so thick down in the lower portion of the lung. The dexamethasone really decreases that from happening. So there's some of the medications. I didn't want to go into too much detail about all that, but anybody else? That's kind of, I think, all I have.
Okay. I'll stop the share. Yeah, because you just had a couple of the links there. They'll be in the packet.
Okay.
This is Lorraine. I just have a quick question.
Sure.
Karen, and maybe I just missed it. Do you know how they came up with which, obviously Texas and Arizona are having some trouble right now. Why did Delaware get added to the list? Are their numbers that bad?
Going up.
I guess they must have. I mean, in public health, there's a term called R naught, the reproductive value. And so when the R naught is less than 1, so what it means is for every one person that is infected, how many other people can become infected. And so the R naught had been less than 1. So that means if one person got infected, less than one other person was getting infected, which is great, because that means that the virus is going down, 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 down. Now, the other day, in New Jersey, the R naught, and I think Governor Murphy calls it the RT. He calls it the rate of transmission, but really, technically, it's this thing called R naught, R with a little 0 underneath the R. And so the other day in New Jersey, the R naught rate went up to 1.03. So it's trending above 1. So I don't know what the R naught or the RT is in Delaware, but that's what they look at. And that's what the public health experts are really monitoring is, for every one infection, how many other people are getting infected.
Right.
Lorraine,
Susan?
I was in Delaware this past week, and there were apparently in Dewey Beach, one of the bars had a lot of people there, and somebody was infected, and that was a big site for a lot of testing afterwards because they think a lot of it started there in Dewey Beach, Delaware. Just from being in a bar, young people being in a bar. Karen, a quick question to you. I've been taking my temperature, excuse the expression, religiously since March, every morning. But I've heard that if you check the O2 saturation level, that's better rather than your temperature.
Well, an O2 saturation level, so yes, that can be definitely a marker. You might know what I'm talking about. I wish I could show you the pulse ox. It's a little thing that fits on a person's finger,
right?
When you go to a hospital or emergency room. So what that's doing is it's actually looking at hydrogen ions as they pass through, as the blood passes past that infrared sensor. And it's a way of telling the blood oxygenation. So when people have COVID-19 and other diseases too, anything that affects the respiratory tract, you're not going to get as much oxygen, so your O2 saturation is going to be lower. But yeah, I mean, not everybody has a pulse oximeter. I don't know how much they cost. We have one at work.
They're inexpensive.
Yeah. They're very expensive, or they're inexpensive?
No, they're not expensive.
Oh, okay.
We just got one.
Oh, okay. Well, then that's a good thing. I know when we have people with asthma, I'll put, I'll go get the oxygen and the pulse ox. And, somebody with an asthma attack, they'll be down, 85, 87. I give them a nebulizer treatment, and then it's back up in the mid to upper 90s or something. So, if somebody's coughing and having difficulty breathing, yeah, their O2 sats are going to be low. But the patients in the hospital on ventilators, yeah, definitely their O2 sats are low. I haven't read anything about checking your pulse ox every day. I don't know. I mean, that's something I would have. In all the readings, I have not heard anyone recommend that. And we don't even really have to take our temperatures every day. I know after that Black Lives Matter protest, Russ and I and the kids, we were all taking our temperatures every day for about 10 days, just because we all had masks on, but I was a little worried, like, what if I get sick from this? But I don't think it's harmful for you. You know what I mean? I don't think it's a bad thing that you check your pulse ox. But I don't think anybody is actually really, to the best of my knowledge, not recommending that. So.
Karen, Susie has a question for us.
Okay.
Karen, I might have missed this, but did you give a number of what the R naught should be, or
less than
idea?
Less than 1. It really should be less than 1. So if one person has the infection, it's less. They're not. they're not passing it to one other. If the R naught is 1, that means that one person that's infected gives it to one other person. If the R naught is 2, that means one person that's infected is giving it to 2 people, and so on. So the fact that it was going down below 1 was great. I mean, we were really trending almost like it was over, but then within a few days, it went just a tiny smidge above 1. And I have to say, as a healthcare provider, I mean, there may be things that people have that they're not as happy with Governor Murphy, but from a public health perspective, I think he is doing a reasonably good job, the best job that could be done, I think.
I have another quick question.
Sure.
When you talked about hand sanitizer and ethanol alcohol, you said, right?
Yes.
Early on, when you couldn't get hand sanitizer and either one of us would go out for a, ShopRite, Lowe's or wherever, we would always look for hand sanitizer. So what we found is something has benzochlorine dioxide. I think that's close enough or close to that. So I don't know if that works as effectively as the ethanol alcohol or not, but we have 2 bottles of it because it says hand sanitizer, and we didn't know then that you should look at the back to see what the ingredients actually are.
From my readings, I have not read about benzo, whatever that chemical is.
I think it's benzochlorine dioxide.
So it's it's a chlorine derivative then.
I know that the CDC has on their website, they do have a list of hand sanitizers that are not good.
Yes. Yeah, right. I should have put that in the handout. That would have been smart. Pastor Brett, sorry.
That's
yeah, if you do.
Sorry, there's a lot of material here.
Yeah.
So if you want to check it out, Susie, I'd suggest going there. And
I will. Thank you.
That is true. And actually, this packet that I'm holding, that is 87 pages that I told you from Rutgers, there is a list of disinfectants that are acceptable and ones that are not. Yeah, I see this. It's from the CDC. So
all right, I'll check.
Cleaners and things like that. Yeah.
Thank you.
Sure. Some questions today about the vaccine. I mean, I don't know if you want to know this speaker today, Dr. Evan Anderson. He actually was representing Moderna, but he was talking about all the different vaccines. And, they said that they feel confident that sometime early in 2021, if they have a good sample size for these phase 3 trials, that they should have the vaccine ready to go to FDA for review, and then it has to be licensed. So, the FDA has to get its hands on it, basically, and then it can be distributed. So, it's very hopeful, very hopeful. And I think the Moderna and the Pfizer, the mRNA vaccine, I think sound like it's kind of new technology. It's pretty cool. The other vaccines, there are many other vaccines, but the chimp adenovirus by AstraZeneca, that is probably going to be available around the same time. And that is more similar to other vaccines that we've had in the past. So, they're the 2 categories that I didn't really go into a lot of detail about all the vaccines, but seem to be the front runners. I thought that was interesting. And one of the speakers was saying they're not sure if 1 dose of a vaccine is going to confer immunity, that they may have to have a booster dose too. And any disease that affects the respiratory tract, they said it's harder to obtain lifelong protection. So, there may be a vaccine, and then a period of time later, you get a second dose. Yeah.
I saw Dr. Fauci speaking last week, and he indicated that those vaccines that you indicated that sound promising, that the federal government is actually starting production of those vaccines now, so that if any of them actually get through FDA approval, that they're ready to go, so that they don't have to wait for production to start after FDA approval, which I thought was great.
Yeah, but they haven't been tested on human beings yet,
No, I
right?
understand, right? But they're
Yeah,
but
yeah.
they're but they're hedging their bets, right?
Yeah.
It says let's those that look promising, let's go make a bunch of them, so that if there's 5 that are going through human testing, one of them comes out to be promising, right? That we have a stockpile of them, which I thought was a great use of our resources.
Yeah, that is good.
I was listening to NPR, I believe yesterday, and they were talking about, I can't remember what company it was. It's going to be a pill. It's not going to be injections. It's going to be pills. It's like,
Wow.
so I'll have to look that up and get that to you. But like they said, it sounds very, very promising. Like there's a lot of promising potential vaccines coming down the road, but I wouldn't rush it,
Yeah,
because
no.
they did. If anybody watched the thing about the polio vaccine and how they rushed that through and it didn't work the first time, we got to be careful. We got to do due diligence on this stuff.
Yeah.
Yeah.
Okay, well,
So
did I meet your needs? Did everybody get their questions answered, or is there
That was
anybody else?
wonderful.
Very good, Karen.
Oh,
Thank you.
Thanks, Karen.
So I just wanted to say in closing that because of the uptick and kind of the more opening of things in New Jersey, the council is reevaluating our decision to have outdoor worship on the 19th. And so we'll let you know the yay or nay on that on this Friday in the email that goes out. So as well as the coffee gathering this weekend. So council is making some decisions about that, but again, always erring on the side of love and caution and all of that. And we will get through this. I just keep being reminded on how this situation is inviting us, you could say forcing us or inviting us to embrace creativity and the possibilities that come with having to adapt differently. And so rather than looking at the negatives, it's good for us. Well, what are some of the opportunities that are happening that we might not have had happen if this weren't amongst us? So
Good thought, Pastor Rhett. Good thought.
Yeah.
So thank you all for being here, but thank you especially to Karen for your vocation of being a nurse and spending all this time, these months, learning everything you can about this virus. I know it's part of your job, but it does sound like you enjoy it as well. And thank you for putting together the presentation. We'll see that the information is available in Friday's special edition. There'll be a link to it that you can snag it there. So thank you to you, Karen.
Yeah, sure. You're welcome. Okay.
Thank you,
Great.
Karen.
Thank you so much, Karen.
Okay.
Hi,
Good night.
Kim. It's good to see
Information.
you. Kim, how are you?
I'm well. Who is talking
It's
to me?
Sharon Davis, and I haven't seen you for ages.
I know, neighbor. How are you?
Yeah, good. How are you, neighbor?
We've got to stop meeting like this.
I know. I wish we could meet other ways, but oh well.
I know.
Is everything
This
good with you and your
This
family?
too shall pass. We're all well. Thank you.
Well,
How
that's
about
good.
you?
Yeah, we're all well too, thank goodness.
Good.
Yeah, good to see you.
Nice to see you too.
Kim, I always love your drapes behind you.
Thank you. I'll tell you that I got them in Target a long time ago.
Yeah, I like them.
Thank you. I love them.
Joan, I like your hair.
Did you find it?
Thank you.
Thank you.
Good.
Oh yeah, your hair's cute.
Yeah.
Today.
I'm going to leave the room open. If any of you want to chat with one another, you're welcome to do that. But Marvin just came home, so I want to say hello. So
Okay.
you're welcome to hang.
Okay. Take care.
Okay.
Thanks,
Bye.
Pastor Brent. Thank you very
Thank
much.
you very much.
Very helpful.
Yeah. Good
Thank you,
night.
Karen. I think I learned a
welcome.
couple things. I really appreciate it.
Pretty good.
Yeah.
Well, I figured everybody
idea.
knows a lot about
We wanna-
You can
COVID,
talk to
but
him.
I just
Say hi,
wanted to
Len.
give some of the
Hi,
most
Len.
recent information if I could.
Yeah.
Yep, you did a great job. It was great.
Thank you. All right,
Thank
well,
you
good
so
night,
much.
everybody.
Good
Good
night.
night, Karen. Thanks again.
Good
You're
night,
welcome.
all.
All right, bye.
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 Oh,
He's good.
where'd he go? Hi. Hi there, Tom. How are you?
Hello, Lynn.
How are you guys doing?
Okay.
Good.
We're going down the shore because it's going to rain.
Because it's going to rain. You know, we picked the
So you
only
need to
time
check
that
up
we're
on
going to let
things.
go. But all this is to celebrate Joan's hairdo.
Yay!
Well, you've got your hair cut too.
Yep, I did.
Yeah. Tom too.
Yep. That was last week.
My goodness.
The whole new world when you can go in and get your hair cut, I'll tell you.
Yeah. Well, yeah, except for all the plastic and the everything. But everything's okay. Nothing exciting.
How's the world,
Yeah,
world of
I
weed
don't-
whacking?
Weed whacking. Well, we haven't been weed whacking lately. I was using Perry's and something happened to it. I was weed whacking and all of a sudden I heard this like crack.
Uh-oh.
And I'm like, uh-oh. And it started real high rev,
Yeah.
you know.
No
So I
strike.
stopped, of course, right away and looked at it, and here the spool that held the
string,
the cord, disintegrated. It just
really. Oh, geez.
And the only pieces I found
was
the two little orange things that clip like that. You push and it clicks in
Oh, jeez.
to the, you know, like here's the thing, and you push this and it clicks
Sure, and
in.
you push it in, yeah.
And the only thing that I found is this clip and that clip.
Oh,
and the rest of the plastic or whatever it was made out of is gone.
Oh, jeez.
And
How are your tomatoes?
good. I went down and checked them after the big storm, and I had tied them up, luckily, just before that.
Good.
So they're still in good shape. They're
Right.
about
Good.
Okay.
maybe up to my
Chest?
waist, or I wouldn't say my chest.
Okay. So they're gone.
Well, past my waist now, you know.
Okay.
So they're growing like crazy.
Good. Good. Can't wait.
So
And how about our Eagle Scouts? How's that going? The thing
I
survived?
would say it's not.
Okay.
Aw. Nothing's growing
Oh, it's growing little by little.
little by little.
They, 2 strawberries died
Oh, geez.
out of the 4 they had.
Uh,
And what else died?
Well, isn't it too late for strawberries anyway?
Yeah. I don't know what those guys were thinking. You know, they never researched anything with the plant or anything. So,
oh,
Now, the blueberries are coming in, but that's a bush.
oh yeah, they're
Oh, yeah.
coming in.
Yeah.
Right now's the time for them.
Yes, yes, I want to go.
We
get-
have a couple blueberry bushes here at our house, and we always see all the lovely green berries, and we're like, wow, we can't wait to taste them. And by the time we go back to eat them, they're blue, and the birds eat them all.
birds have
Birds
got
eat
'em. Oh, yeah.
Just like that.
Yeah.
Yeah.
The deer wiped out my hosta. We were at the
Oh, my
shore for
God.
the day, and they wiped it out,
Didn't,
along with impatience.
I made the mistake of turning off my sprayer. It's my fault.
Yeah.
I did.
Yeah.
I didn't say
I turn it on at night, but I turn it on off during the day because I'm the guy who gets wet and so forth. But
they stand right on the
They-
brick
right up on
patio
the brick-
and look at us.
yeah,
You know, I swear we had deer down at church too, because out front, I planted portulacas there beside the old church front door to the left, that little patch in there. So I go to water, I've been watering everything. So I go to water, and here the first 2 rows of them are just trimmed off,
Trimmed
you
off.
know, like something munched them.
Yeah.
And
Did
I'm
you
like,
see footprints too?
yeah, and I saw what I thought
Oh,
were deer
okay.
prints, some V, you know how they make a V
Yeah.
mark? So I thought I saw some of them, and I'm like, what would they be doing out in front of the church? How did they get out there?
Just
You
crossing
know.
Route
Route 70
70
is just
is-
walking around
And-
there. Yeah.
And then
So,
out in front of our place, you know, some of the higher plants here, you know, daisies and stuff that are like up to my chest almost, they were all trimmed off. So something must have walked down the street or this way, saw them and ate animal off. You know?
Oh, yeah.
I'm like,
Yeah.
I
The
don't know.
love-hate relationship I have.
Yeah.
I give
This
up.
guy, the one that we think got it did come right up on the patio.
Right up. Yeah.
And
Yeah.
we're standing, we're inside with the sliding glasses, but we're within 12 feet of him. And we're looking, and he's looking at us, and he didn't move until we slid it open, and I yelled and so forth.
You gotta get a BB gun.
And the dog did not, yeah, told him nothing. Didn't even spot it.
I think she's in her retirement years, isn't she?
Yes.
Yes,
Yeah.
definitely. Wow.
Okay.
All right. Well, it's nice to see you
Nice
guys.
to see you.
Me too. Have a safe time at the shore.
Yeah.
Are you guys coming back tomorrow night then, or what? Are you guys gonna come back tomorrow night? Are you gonna?
No,
wait up
we're
the storm?
gonna, this will be the first
sleep
overnight
there.
for us.
Oh,
We haven't been, yeah, and it's gonna be a stinky day,
yeah.
Luckily, the family's been using it.
Yeah.
Grandchildren and Chris and so forth.
Yeah.
So that's good.
Oh, yeah.
So they've been using it.
Are the kids still staying at your place down there?
No, they've been,
No.
They've been back and forth.
Yeah, they come back and forth.
Well, actually, our sheets are in transit as we
Yeah.
speak.
Now, Megan had 5 of her close friends there, and they used every towel that we own.
Everyone.
Every,
And brought them up for
brought
washing.
them all up for washing. We had them. So,
Well, if you find yourself down there,
yeah.
we'll be there till Monday
Probably
morning.
Monday.
So,
Monday, Tuesday. Yeah.
Well, we're still trying to decide if we're going to Colorado, and it could be on Tuesday. So.
Oh, wow.
okay.
Really? Okay.
Yeah.
Well, good
So
luck.
Double mask and sit in the plane, huh? Yeah.
Probably. If we go, yeah.
I'm sort of leaning against it myself, but
Well,
I don't know.
yeah.
Tough decision.
Yeah, we should be going down to Fort Lauderdale. We're trying to finally clean out my stepmother's place.
Mhm.
And Robin says, I'm not getting in a plane. I can't do that and operate a children's business.
I don't blame her.
Yeah.
It, especially like going to Florida.
Sure.
Yeah.
Oh,
That
yeah.
place is
Fort Lauderdale.
it's like real bad. Yeah.
Oh, well. All right. Well, we come see
See-
you. Sit down.
See you.
All right,
Take
bye-bye.
care.
Bye-bye.
Stay healthy.
You too. Yeah, how do we get out of here?
Up the top there.
I can't read it. Nope, that's not it. That's not it. Cancel.